So Leslie is a dog groomer, and so she's on her feet a lot, and she's lifting animals up and down off her grooming table. And she came to me with symptoms of pelvic pressure and feeling, things were falling and a bit of a bulge in the vaginal area. And she had uterine prolapse.
The reason this happened was lack of estrogen due to menopause, the fact I had 3 children vaginally, and the lifting of dogs. I'm a dog groomer, and owning this property. I'm constantly out lifting stuff, pulling stuff, so they said, I'm going to have to change all that. I was a nervous wreck, but they seemed to be like, well, yeah, it happens all the time, we can get this, and they explained what they were going to do with the surgery.
You could need 2 separate surgeries. One to remove the uterus and one to do the reconstruction. The thing that's exciting at Inova Loudoun Hospital is that you can get both those surgeries on the same day, under the same anesthetic, with the same incisions.
I've been going to Dr. Thompson for a long time, and I trust her. And Dr. Young's, when I met her, and she treats you like a person, not like a doctor dealing with a patient, using all the medical terms, I felt very comfortable with her. And they were going to do the robotic thing, So she was explaining about the robotic, and the first thing I think is, a robot, are you all going to go to lunch and leave it, doing this thing by itself? And she laughed and she said, no, we're there, we have to operate it.
The robot is a tool for us in surgery. The robot still requires a surgeon, and a surgeon trained in robotics. The robot does not do the surgery for us. It makes our motions more precise. So when I move my hand 5 inches outside the patient, I can set it so it only moves 1 inch inside the patient, so it makes my motions more precise. It filters out the natural human tremor that occurs, and that's a big difference between laparoscopic surgery and robotic surgery, where if I'm holding a long laparoscopic instrument, you'll see a fine little tremor here, but with robotic surgery, the robot totally filters that out. And very important for reconstructive surgery is the robot gives me wrists. This is something that's not available in laparoscopic surgery. And not only does it give me wrists, but it gives me supraphysiologic wrists that rotate even further than a human wrist. So when I'm sewing mesh and doing a reconstruction, I have even more ability. Those are just some of the advantages that the robotic technology gives us.
I didn't really want to be cut open. That sounded like it would be a lot more. And I talked to other women. They were telling me a couple of them had been cut open and said it was a long recovery. They said, you don't want to do that, So I said, okay, I'll go this route because it seemed pretty simple.
Leslie did great post-operatively.
The recovery was like nothing. She said, after a week, I want you to walk to the mailbox. Well, I was outside the next day. She said, the more I walk, the better. But give myself rest. I just stayed home for, I'd say 12 days. But I could still groom my dogs.
She was really impressed, and as I am always, about how quickly she recovered. Just with the small incisions, people are really up and about quite soon after surgery and with very minimal amount of pain. She didn't hardly take pain medicine after surgery, and that's what I see with a lot of robotic patients.
It takes a whole team of people to make the robotic surgery go smoothly. And the team here is wonderful. I love working with them. I love coming to work here, and I know that our patients will get great outcomes and great post-operative care up on the floor as well. So I'm a proud member of the robotic-assisted surgical program here at Inova Loudoun Hospital.